My amendment would prevent the Substance Abuse and Mental Health Services Administration from implementing any further mass layoffs. And that is because while I fully support the SUPPORT Act, I am concerned that none of the work necessary to implement it can happen without the SAMHSA workforce. SAMHSA leads efforts to address our nation's mental health crisis, including focused initiatives to reduce the rates of suicide and drug overdose. But on March 7th, Secretary Kennedy announced that SAMHSA would essentially cease to exist as employees are fired or absorbed into a consolidated office. And without an agency dedicated to behavioral health addressing suicide, overdose, and youth mental health issues, these issues are less likely to be prioritized. On April 1st, Secretary Kennedy fired nearly half of SAMHSA's remaining staff, including the director of SAMHSA's Center for Mental Health Services. He then fired the entire Office of Population Surveys, and this is the team that oversees the National Survey on Drug Use and Health, our only national survey focused specifically on drug use and mental health. And it is unclear who, if anyone, is going to take on this crucial task of tracking drug use and mental health in our country. In recent years, we have made progress reducing overdose deaths in large part due to SAMHSA's programs addressing substance use. But overdose deaths remain the leading cause of death for younger adults, underscoring the need to ensure that this program continues. And recklessly firing staff without cause deals a devastating blow to our efforts to prevent overdose deaths in America. SAMHSA also administers grants that support the 988 National Suicide Prevention Lifeline, which in its first year received 4 million calls, a 33% increase in people reaching out for help. Yet in February, a quarter of the 988 Lifeline team at SAMHSA was fired, and these are critical mental health programs. SAMHSA's Pregnant and Postpartum Women's Substance Use Disorder Treatment Program, which funds parent-child residential treatment and critical workforce training programs, would be eliminated with about a 92% cut. But substance abuse is a significant factor and one of the leading causes of death in the maternal mortality crisis. In Virginia, SAMHSA grants fund programs tackling substance use, mental illness, grief, trauma, and challenges faced by individuals. And yet, this funding is at risk. And it's important to understand that these workforce cuts, these firings, these layoffs, don't happen in a vacuum. The bill that this committee, that this House just passed, will cut Medicaid and will put at risk a lot of substance abuse programs that Medicaid funds, particularly in our rural areas. In addition, the president has proposed slashing SAMHSA's funding by almost another third, eliminating another 30 critical programs that focus specifically on substance abuse. So when you think of everything in a totality, I support the SUPPORT Act. I think the SUPPORT Act is critically important to addressing substance abuse and the maternal mortality crisis and the suicide crisis and the gun violence crisis, because many gun violence incidents are a direct result of either mental health issues, suicide, or mental health issues or suicide or drug addiction. And yet, if we don't have the workforce to implement the SUPPORT Act, what are we doing? We're wasting our time, and we are telling the American people, on the one hand, we're solving a problem when we're actually tying our hands behind our back to make sure the problem actually gets solved. And so with that, I yield back.